Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, having regular periods can mean that the reproductive system is functioning as it should. If menstruation comes with severe pain, heavy bleeding or mood changes, a healthcare professional should investigate the possible causes and provide treatments. So, to discuss on this, we are being joined today by Dr. Arpana Das, consultant gynecologist from Critical Care Hospital. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken, I'm sure the viewers who are watching our show must be benefited with the topic and the discussion we are going to have today, because this is the common problems we have been seeing in every household, in every maybe in young girls or the age we are going to talk in our discussion. Now, first off, if we would like to know what is considered to be normal menstrual cycle or period, what would be that, doctor?
Good afternoon. Actually, menstruation is the periodic shedding of endometrium. The endometrium is the inner layer of uterus.
Okay.
It sheds every month, and there is an interval for this period, and we considered about 21 to 35 days is a normal interval. And now comes to the duration of menstruation. Duration is we consider normal, it is 2 to 8 days. And the amount of blood flow which we consider normal is about 20 ml to 80 ml, but this is very difficult to assess what is the amount of blood loss by common people. No, so if you are passing clot, the big clot, or you have to change the pad every 1 or 2 hourly, then we consider it to be a heavy flow.
Okay.
And there are some other associated normal symptoms also, like if you are having mild cramp in the lower abdomen which is bearable and it is not means it doesn't last more than 24 hours and it radiates to thigh or back, then we consider it normal. But if you are having severe pain and it lasts throughout the period, then we may consider it to be abnormal and we have to investigate it.
Okay, okay. So there are certain problems, there are certain problems which is being related to the menstrual cycle and also the basically the period problems we are talking at this point in time, doctors, with the doctor. And our numbers are flashed on your television screens, viewers. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your question, because doctor is here to give you all the answer. Now, doctor, coming back to you again, there must be some common menstrual problems as well. Now, what are those basic and the common problems which we hear every day, and you also have those cases in your hospital as well?
Actually, the menstrual problems are different in different age groups.
Different age groups.
Different age groups. Suppose in a teenage girl, the most common problem is menstrual cramp. Most of the school-going girls or college-going girls, they are having pain or cramp in the lower abdomen during menstruation. And as I told that it may be normal or it may be abnormal.
Okay.
If they have pain, mild pain, and it is bearable and it is not doesn't last more than 24 hours, then we consider it to be normal.
Okay.
But if it is last throughout the period, it is very severe in nature, it may present in between periods also, then we may consider it to be abnormal and you should consult a gynecologist. Again, other next common symptom is increased flow, means heavy flow.
Heavy flow.
Heavy flow. As I have said, if you are passing clot in periods and if the duration of period is more than 7 days and you have to change your pads every 1 or 2 hourly, then we may consider it to be abnormal, and we have there are many reasons for that. There may be any tumor of the uterus or there may be any hormonal problem. So we have to consult a gynecologist for that. We have to investigate and then we have to treat.
Okay.
And other problems are like irregular period. It is very important and very common problem, irregular periods. Some girls have this period 2 to 3 month interval, which may extend up to 6 months also. They don't have period up till 6 months.
Okay.
After that, when they get period, the bleeding is very severe, very heavy bleeding, and it lasts for many days, 15 days or 1 month also.
Okay,
That type of patient also comes. So we have to investigate the cause. There may be many causes of this irregular bleeding, and some may have spottings, means every 10 days, 5 days, they may have
Some spotting.
Some spotting.
Okay,
So
okay.
these are also problems. And in the later age group, like after 30 years or 40 years, most of the women come with heavy bleeding.
Okay.
The signs of uterine tumor and all, like fibroid or adenomyosis, these are more common in beras, means after 30 years or 40 years. At that period, they may come with heavy bleeding during periods, or there may be severe pain during periods.
So these are some of the basic problems, some of the common
yes.
problems which maybe one or the other time every lady or every woman goes through.
Yes.
Now, if we talk about the teenagers, now they also go through some kind of problems as well.
Yes.
So on that note, what would you like to suggest those parents out there to how to, because they have a lot of questions in their mind as well, because as teenage girls, as they are going through their first period, or maybe a period which is not at all like a questionable, because there are a lot of things they have to understand, they are going through it. So on that note, how do you talk to those parents, and how do you tell the patient that this is normal and things will become okay?
See, when a girl get her first period, there so the system is not mature. That's why the irregular periods or heavy bleeding.
So that is normal in her case.
That is normal in her case. If just first time if she is getting period, she may not get period for 2 to 3 months or more like that, because the system is
trying to adapt things.
Yes, adapt things. It is not mature. That's why there may be irregular periods, there may be cramps, there may be the increased flow like that. But if she is having increased flow, then there may be health issues. That's why they should consult a doctor. Otherwise, if she is having little flow or some irregular periods and some mild cramps, these are normal in that age group, and they shouldn't bother. But if she is having, again, one more thing is there, in this period, in this age group, like a teenage group, they don't know how to maintain hygiene. That's why this is very important for the parents to teach them how to maintain the menstrual hygiene. This is very important, especially the mothers.
Menstrual hygiene is very important. Period hygiene we are talking about, that is also very important. How to take care of that. If we are talking about a teenage girl or anyone else, that's very important to just not have another problem in your life, isn't it? So on that note, like what kind of like basic hygienes you prefer to like to talk on this topic?
See, menstrual hygiene is very important, especially during menstruation, because this vaginal pH, they maintain a specific pH, acidic pH, 4 to 4.5, and this is the pH in which some commensal bacteria, that is, we can call it security guard of our vagina, which prevent infection in our vagina. But during menstruation, what happens is there is blood in the vagina. That's why the pH become alkaline, and because of this alkaline pH, there is increased chance of infection in the vagina, and moreover, the mouth of the uterus, which is called cervix, it is open during menstruation. That's why when there is infection, it will go inside the uterus, which may cause some other.
So one has to be very careful.
Very careful during menstruation.
So does it also lead to urine infection as well?
Yes, it can lead to, because of this increased chance of infection in the vagina and urethra, which is this is very nearby vagina, and there is more chance of infection in urine too. So how to maintain hygiene, we have to know. Means we have to bath regularly. This is basic. Twice daily we have to bath. After that also we have to wash our private parts regularly, and this is also very important. We don't have to use soap, because soap is alkaline again, and we don't have to use soap in our private part. With lukewarm water we can use to wash it, and the direction of wash will always be from front to behind, because there are some bacteria in the anus also, in the rectum also, and when we wash our vagina from back to front, then there may be again chance of infection. So that's why we always have to wipe our vagina from front to behind. Again the use of the sanitary napkins. Many women now also they are using cloth. And this is very wrong thing, unhygienic, wrong thing, because they are using it after washing it again and again, and this may also lead to infections. That's why the sanitary pad is the best option, and this sanitary pad also you have to change it every 3 to 4 hourly. If you
maybe depending on the flow as well, or do you also suggest for 3 to 4 hours?
3 to 4 hours.
Mandatory.
Mandatory, because if you are having very less flow and you are using this pad for 5 hours, 6 hours, or more than that, then there may be chance of infection, because this little blood also, it may invite infection.
Doctor, we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Yes.
Hello.
Yeah, I just wanted to ask that is it normal if someone gets periods for 1 to 2 days and but the cycle is like I guess after every 28 days, but quantity is very little. Is it normal?
Not getting it.
Hello, I'm not getting you. Please ask your question once more.
A bit
Yeah, is
louder.
it normal to get periods for 1 or 2 days? Like the cycle is, I get within 28 days, but the quantity is very less. It stays only for 1 or 2 days, sometimes three.
What is your age? What is your age?
30,
Age.
Could you please tell your age? What is your age?
30.
30.
30. Are you using any oral contraceptive pill?
No.
No. Actually, if you are having 2 days of menstrual flow, as I have said, it is normal. Some women may have less flow or some women may have more flow. But if if you are using some contraceptive pills, then also the flow may be very reduced or some other medications.
Okay.
So we have to know whether
Okay, so we have to actually rule out the cause,
Yes,
what
yes.
exactly is the problem, and then only prescriptions on
Yes,
a
yes.
treatment procedure can be started at the earliest. All right,
Again-
thank you so much for calling, but the thing is like it's better to diagnose early and then see a doctor. So this was my next question to you, doctor. Like when is the right time to see a doctor? Like we have seen often we try to ignore things, often we try, suppose if we are having a cramp, so we think that it's a normal affair, but still if that prolongs for a long time. So when is the right time to see a doctor?
As soon as you feel that it is not normal for my normal thing, then you should consult. Like if you are having pain, but you cannot bear. But again, one thing, the threshold of pain is different for different person. The same amount of pain may be very painful for one person and other person
Okay.
can bear it.
It depends on the
Depends
person to
on
person.
to person. But that's why if you are feeling that I am having more pain and it is very intolerable for me, then you should consult a doctor. Or
Okay.
you are feeling that the flow is heavy than normal, then you feeling the doctor. Doctor will decide whether you are having normal flow or you are having some abnormalities.
Okay. Now
After
let's,
sen-
doctor, talk about the cramps. Now it can be a normal cramp as well as abdominal cramp. Now if we want to differentiate or want to know about what is normal cramp and how to rule out if it is an abdominal cramp, so how what would be that?
Actually, normal cramps, actually the cramp in medical term it is called dysmenorrhea.
Okay.
Dysmenorrhea, it may be primary or secondary. Primary means normal, what we call normal cramps.
Normal cramp.
It is actually happens in teenage girls mostly, and it is subsided after childbirth or after pregnancy. And it is located in the lower abdomen. It is crampy in nature. It may radiate to back or in the thighs, or it is bearable, or it will not last more than 24 hours. But in this secondary dysmenorrhea, it is because of some pathology in the reproductive system. It may be different pathology. Like in case of endometriosis, the pain will start before menstruation, menses. It will worsen during menstruation and it will subside after menstruation.
Okay.
Like in case of fibroid or adenomyosis, like these are the tumors of uterus. Here there will be pain throughout the period, and associated with it there will be heavy bleeding during period. So different in different cases.
Different in different cases, but one has to rule out things, and for that better is to see a gynecologist or a doctor you prefer to, and then things will be clear and the treatment will be started at the earliest. All right, doctor will have the conversation, but we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on menstrual problems and problems related to other health issues as well. So we are having a conversation with you, doctor. Now, earlier to the break, we had a basic knowledge about the common problems relating to periods, and we were also touched upon the teenage girls and as well as the normal flow, which we are talking, and also the period hygiene as well. Now, doctor, if we talk about the irregular period, now irregular period is also a common discussion which is being surfacing. So what is the root cause? What is the cause behind it?
Irregular periods are very common nowadays.
Yeah.
Most of the patients in our OPDs are coming with irregular periods.
Okay.
There are different causes in different age group. So most common cause is the PCOS or PCOD, where what happens is the girl will have a period of about they don't have period for 2 months or 3 months or maybe up to 6 months. And
Okay.
when they have period, they will have bleeding, heavy bleeding. It may last for 15 days or 1 month also, and there may be heavy bleeding. And associated with it, there may be some other symptoms also, like obesity, means they will have weight gain.
Okay.
Or there may be acne not only over the face, they will also have acne over the chest or over the back.
Okay.
And then there may be facial hair growth, there may be other symptoms like mood swing and all.
Okay.
Along with this.
So these are the basic
And
causes.
other causes are also there, like some hormonal problems, like
Okay.
the most common is the hypothyroidism, that means thyroid problem.
Thyroid problem.
Also causes irregular period.
Okay.
And, in thyroid problem also there will be weight gain and all. And other hormone related problem like hyperprolactinemia. This prolactin is also a hormone. If there is increase in the prolactin level, there may be also irregular periods.
Okay.
And in some cases, very rare cases, there may be some ovarian tumor which secretes hormones,
Okay.
and that also causes irregular periods. These are also causes, but some other, these are the causes of having interval more duration.
Okay, okay.
Less interval period, which is also we see like polymenorrhea, which is called polymenorrhea. There may be some tumors inside the uterus like polyp and all. There may be cervical erosions and all. In that
Okay.
cases, we may have frequent periods, like every 10 days or 15 days we may have period.
So this is a basic cause of it. Now, is PCOD and PCOS same doctor? And if one is having that problem, so when is the right time to see a doctor, and what kind of test is being done? Do you suggest for ultrasound? Do you suggest for blood test? What is the first thing that is being suggested by you?
Okay, if a girl or if a woman come to me with irregular period, the most first thing comes to my mind.
You take a history of them.
Yes, along with this weight gain and the facial hair and all. The first thing come to my mind is PCOS. So I have to investigate it. The first line of investigation is ultrasonography. In ultrasonography, we can see the ovary is enlarged in volume. There is multiple cysts, multiple small cysts inside the ovary. We can see, and other some hormonal studies also we do, like serum FSH and LH level. We can see also prolactin level, thyroid hormone level, etc. And some other, if there will be the ratio of FSH and LH, it is altered. Actually, main pathophysiology of PCOS is in the there is FSH and LH. These are two hormones. These are secreted in the brain, and there is alteration of these hormones. And because of this hormone, there will be the follicles. Actually, what happens is normally every month there is a follicle develops, and at about 14 days of menstruation.
So it develops in every woman?
Every woman in every month there is development of follicle. Development of follicle in every menstrual cycle, and in about 14 days of menstrual cycle there is follicle will rupture and it will release an egg. And it is because of the hormone FSH and LH, and this egg will go into the uterus through the fallopian tube, and if it is fertilizes, then there will be pregnancy. If there is no fertilization, then the shedding of the endometrium, means inner layer of the uterus along with the egg, and there is menstruation. But what happens is in PCOD, there will be development of follicle is not proper because of the this alteration in the level of FSH and LH, and there will be formation of multiple follicles, and there is no rupture of follicle. That's why there is no ovulation in PCOD, as well as there is no menstruation is delayed.
So how soon you start the treatment, doctor? Because this also leads to their future prospects as well. Because it might have infertility also if a person is trying to conceive as well. So there might be some problems as well. So how soon is the treatment started? And there is an hesitancy also in some women as well, because there are a lot of questions in their mind that will the treatment be positive or not. So on that note, how do you convince the patient? And there is a psychological effect and a psychological problems as well. So on that note, how do you convince those patients?
PCOD is a lifestyle disease. It is not a disease like I have given medicines and it will cure. It is not like that. It is a lifestyle disease.
One has to live it with.
Yes. That's why if you the first line of treatment in PCOD is weight management. If you reduce your body weight by 5% also, then the maximum of the symptoms like irregular period or infertility or some other this acne and all, these will go. by reducing weight only. If
Okay.
after weight reduction also, if it is not possible, then we will prescribe medicines. And medicines are different.
So weight is a very important
Very
issue.
important
Very
issue.
important
Yes.
issue. Okay.
If you reduce weight, then the first line is weight management. If it is not, after reducing weight, if it is not controlled, you are having such symptoms, then only we are giving medicines. And medicines are different for different women. Like if you are teenage girl, then it will be different. If you are married and you don't want to conceive, then it will be different. And if you want to conceive, then treatment will be different. So accordingly, we will give treatment.
Okay.
But first line of management is weight reduction, and it is done by lifestyle modification, by weight reduction, physical activity, and diet.
Absolutely. Now, this is an important question, Doctor. Lifestyle management. Now, we
Yes.
have seen that everybody has become busy
Yes.
with their lifestyle. Lifestyle is changing, and things what we are adapting is talking about the diet as well. We are not having a proper diet
diet.
and proper lifestyle as well. So, this also might lead to these kind of
this
problems,
one.
PCOD
And
or
stress,
PCOS.
Stress
is
is
one
very
kind
important factor. If you are having stress, then we cannot reduce weight, no?
Okay.
And that will also lead to non-treatment of PCOD. So first, we have to balance our nutrition, balance our diet. We first have to avoid the junk food, which are
Okay.
very common in nowadays. We have to avoid junk foods. Then at least 1 hour of physical activity is very important daily.
Okay, 1 hour of physical activity. So, on
minimum
physical,
1 hour physical activity.
on
and
the lifestyle mode now, how to have a basic lifestyle, how to have a good lifestyle, what would you like to tell doctor on that? Like how a women can have in between of their work as well, so they can take out some time for them as well.
Yes. The first to diet, we have to avoid the junk foods, and if it is possible, you always have to take the homemade food. But sometime in 1 month or 15 days, you can take junk food.
Sometimes it's not
Yes,
possible
not
also.
possible also.
Yeah.
But it is better to avoid if you can.
If you can,
If
yeah.
you can. And homemade foods are always good, and the food which are rich in protein, less carbohydrate and less fat, these foods are very important. And if you want, you can consult a dietitian also for PCOD diet.
Okay.
Again, lifestyle management, like 1 hour of physical activity, this is very important. Anyway, physical activity, running or walking or any other physical activity, if you can do, then it is very good for.
Very good. Now, doctor, we have also seen now if a woman is in during her periods, like we have seen that they don't have that urge to have any kind of like food, or maybe some vomiting tendencies are there. So, is it normal for them, or one has to take care of that as well if something has become more?
See, in teenage girl, if with menstrual cramp there is a tendency to vomiting and they don't want to take food, these all are normal. And these are these are hormonals too.
Okay.
That's why if you don't think that this is my period and I don't go to work or don't go to college or school, that is not the thing.
So
if
one has to divert their mind.
Yes, divert their mind, and they have to do the normal routine activity. If you are an athlete, then you can means you can play during your periods. If you go to school, you can go to school. You are college going girl, you can go to college. If you are doing your normal activity during periods, then everything will be normalized. The
But if we
symptoms
tend to
will be
think,
reduced,
yes,
reduced by 50%.
Okay, if we tend to think that what has happened and something we try to, of course, if it's a severe pain or
then-
of course
then you
if
need
something
medical
severe is
attention.
happening with you, then of course you have to think and then see a doctor as well, but or take medicines as well. But do you prescribe medicines for all time, or if one can avoid, that's a pretty good thing?
Yes. If say first, since all medicines have some side effects. Okay, so if someone can do without medicines, he can bear the pain, but not to extent. Say you have to lie down, or say you don't have can't do the normal physical activities or normal activities.
Okay.
Then we have to give medicines. One painkiller. If she is the pain is reduced
It's
by
not
one.
bearable.
Yes, one painkiller.
If it's bearable, it's fine, but if it's not,
she can, the pain is reduced only one painkiller in a month, that it is not bad. You can take simple painkiller also, not like heavy medicine you have to take. Simple paracetamol also do.
Now let's talk about, doctor, about menopause as well. Now menopause, if a woman is going through her menopause stage, now what is the basic symptom that the person will understand, okay, so the menopause phase is nearing? And we have also seen that what the age was earlier, now the age has also decreased, isn't it?
Actually,
what is the right time for a menopause?
See, in India, actually, we consider it is 45 to 55 years is the normal age of menopause.
Okay.
But we see many patients who are having menopause at 40 years also. So, we consider it normal if it is menopause, a patient attains menopause after 40 years.
After 40 years.
Yes, we consider it normal. But if a lady gets its menopause very early, then she may have some symptoms also.
Okay.
Some may not have any symptoms, and some have symptoms like most common symptom is hot flashes. Means she feels heat, a sudden feeling of heat. After that, there will be profuse sweating.
Okay.
There may be other symptoms like because of the weakness of the bone, there may be backache or there may be joint pains,
Okay.
and sometimes there may be vaginal dryness or itching over vagina, and sometimes it may lead to urinary infection also.
Okay.
So these are the symptoms, and if she faces any symptoms, then she should consult a gynecologist.
Okay.
And one more thing, if
It might be normal also for some
and
ladies.
some psychological problems are also there along
Okay.
with during menopause,
Menopause.
like mood swings and depression. This all happens during menopause.
So that's very normal.
That's very normal, but they may need treatment.
They might need treatment.
Yes,
Okay.
but one more thing is that they have to. Again, in these cases also, physical activity, yoga and all, they have very important role in these cases also.
Okay, okay.
Because one more thing, stress is very, the stress is very, means a harmful effect on that symptoms.
So try and reduce stress, what
Yes.
we have seen, the key
Yes.
point of today's discussion, and have a proper lifestyle, which is very important for any kind of like disease. One has to suppress the disease, so you have to have a proper lifestyle as well. Doctor, we are really short of time, so if you want to pass on any message to our viewers, what would you like to tell?
Okay. So be healthy and have a physical activity along with balanced diet, because it will it is very important for a healthy menstrual life. Along with it, the menstrual hygiene is also very important. If you maintain your menstrual hygiene, you can prevent many of the diseases like pelvic inflammatory diseases or infertility, etc.
All right. Thank you so much, Doctor, for joining To Good Life, the health show, and putting on those wonderful messages. And I'm sure the viewers who have watched our show must be benefited with the answers the doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.